Hi, I'm Dr. Era Dutta and I'm a consultant neuropsychiatrist and a life wellness coach. I hold an MD in psychiatry, a DNB in psychiatry after my MBBS. I practice in the city of joy, that is Kolkata. I'll be interviewing Dr. Ishad Agrawal today, and Dr. Ishad Agrawal is a consultant dermatologist practicing in Kolkata. He has an MD to his honor after his MBBS, and I'd love to pick his brains about everything relatable this summer about skincare. So if you have any questions, please shoot them my way.
Hi, Dr. Era. Thank you for making me part of this wonderful initiative. And to all the lovely people out there who send their queries through Dr. Era, this is Dr. Ishad Agarwal. I am a consultant dermatologist in the city of Kolkata. And I don't just treat your skin allergies or your rash. I try my level best to make you the best version of yourself by making sure that you have the best looking skin, the best looking face that there can be. So I hope this session is going to be very beneficial to everybody. Keep your queries coming. I love answering to queries on skin and hair. And let's begin this with the first question that Dr. Ira has asked me. Thank you.
So, Dr. Shad, I have a bunch of questions that have been shot my way from friends, families, from followers on Instagram, and in general. These are all skin related. Some of them, most of them actually are by women, but some of them are from men. So, the first question is about summers and SPF. We're all very confused about what SPF sunscreen to use when we go out in the summers, even though, of course, right now nobody's going out, but still, what SPF is recommended for Indian skin?
Thank you for the question, Dr. Iram. Now, you've asked me about SPF, and you've also mentioned that although people are not going out, they're indoors, and what SPF should they be using? Well, I think let me begin by saying that the beautiful thing here is that you've mentioned is that you're all staying, in fact, we are all staying indoors. Let me break a myth where people think that it's only essential for them to wear a sunscreen when they are going out. But if you look around, even during the day, we have all kept our curtains open. We are all hooked on to the internet. We are sitting in front of our computer screens, our TV screens, and there's a lot of light which is getting emitted, and it's falling on our face, on our skin. Now, this light has a tendency to cause, you know, tanning. This light has a tendency to cause facial aging. Therefore, I would highly recommend to wear sunscreen even during the lockdown, even when you are indoors. Now, coming to the second part of the story, that SPF. Now, SPF is nothing but the sun protective factor. Now, for most Indians, we've been genetically blessed with melanin. Now, melanin is supposed to protect against sun and its damage. So, we don't need very high SPF. Something about SPF 30 for an average Indian skin is very good, unless of course you have sun related allergies, you have sun related burn tendency, you have extreme tanning tendency. That is where I would recommend using a sunscreen of the SPF maybe 40 or 50, especially if you are going to go outdoors, if you're going for a vacation on a beach, if you're going to the mountains where there's more sun exposure. That is where you can use a higher SPF sunscreen, but on a day-to-day basis SPF 30 is fair enough for Indian skin. Thank you.
Now, this question is by a man, and that's why it's very interesting. It's almost like from the movie Bala. Men usually obsess more about their hair, and mine seems to be falling and prematurely graying. So, I can identify I have some premature grays as well, but men in general do fret more about their hair. What kind of tip would you advise for me? I'm a young man, just 29-year-old. So, for a 29-year-old, for premature graying and for hair loss, what would you advise?
Wow, this is interesting. A question from a man, and I am not surprised that this is about hair because 80% of my consultations with men are on their hair loss, and more of them are now young guys in their 20s who are coming with hair loss. Now, there are two parts of the question. One is premature balding, and one, of course, is premature graying. Now, let me address premature graying first because let me break this to you all here that graying of hair is more or less genetic. If your genetics is rewired or let's say wired to have graying of hair, you are going to get that, and there's not much you can do about it. Bearing there's a small percentage of people in whom the nutritional deficiencies cause graying of hair, so maybe adding biotin to your diet if you are having graying of hair is going to help you a lot. But if you have graying of hair, especially premature grays, there's not much you can do about it. There are a few lotions which are in their experimental stage, and we don't have much data on that. So my only request is, do not experiment with costly products. It's not going to be of much benefit. um, Learn to live with the grays, or maybe just do a hair color, but don't experiment a lot. And definitely add biotin to your diet. Now, coming to the second part where we can really help you is the premature balding or premature hair loss that people are experiencing in their 20s, especially men and boys. Now, let me tell you that most men, because of testosterone, are wired, okay, to get hair loss. This is called as male pattern baldness. Now, if uh, if you look at your parents, if you look at your uncles, you would see that most men in today's age are balding faster. And the reason is, now we are also compounded by bad lifestyle. We have poor nutrition. We have too much of work stress, too much of stress in our lives. So all that contributes to the loss of hair. Now, the two things we need to do for good hair, especially I'm going to address this query by this 29-year-old man who wants remedy for his hair loss. Now, I would highly recommend, please cut down stress from your life. Eat well, work out. One part, okay, that is modifiable. Second is, only and only stick to minoxidil for the beginning. Okay, minoxidil is a tried and tested formulation which is prescribed by dermatologists all across the world for hair loss in men. So initially, I would highly recommend for you to use minoxidil. It's later you can go for other treatments like PRP therapy, for hair transplantations, or you can even use, for people in whom we can't help them with anything, they even use a prosthetic hair. But those are for much greater degrees of hair loss. Initially, stick to minoxidil twice a day for about 3 to 4 months, and you'll see a lot of change in your hair. So don't worry about that, and please do visit a dermatologist. Do not self-medicate yourself, because you can have side effects, and a dermatologist will be more suited for you to address these kind of queries.
The next question is about nutrition, about what food items should I have to help in increasing my hair growth and in making my skin better. Please advise.
Okay, this is very interesting and something that I really and thoroughly believe in. What we eat directly affects our skin, okay? And I tell this with utmost conviction to everybody who comes to me, because your skin is like a mirror of your body. Whatever is going wrong with the body is going to get reflected on the skin. Now, 80% of the people these days are suffering from issues like metabolic syndrome. Women are suffering from PCOD. People are suffering from all kind of lifestyle diseases, and that is reflected on the skin in form of black patches, thickening of the skin, premature aging, dullness, lack of glow, dark circles, everything, right? So a diet that is very rich in few things is essential for you to maintain a good skin. So a diet rich in antioxidants, a diet rich in vitamin C, a diet rich in essential fatty acids. So these are the kind of things I would advise you to have. Please go ahead, have lots of fruits, lots of greens, lots of seeds, to have a healthy skin. You can even get supplements in form of multivitamins. You can get supplements of collagen. You can get supplements which are skin boosters. So go ahead, eat all of them. But supplements are never, I mean, I again tell this to everybody, supplements are not a replacement of a healthy diet and a healthy lifestyle. So please do eat foods rich in antioxidants, vitamins, foods rich in essential fatty acids and essential minerals, which means green leafy vegetables, salads, legumes, uh, seeds, nuts. In fact, please go ahead, consult a nutritionist. They would be able to tell you much better. But this is what I generally advise my patients to have a healthy skin, hair, and nails.
So recently I did this poll on hair on my Instagram, and I love these fun quizzes where people interact with me. So one of the most interesting thing that I asked was, what are some of the quirky things that you've heard about applying on your head for better hair? And there were a lot of answers. The most common of them was onion juice. So I want to know if there's any merit to it, if this is a myth or if this is a fact that onion juice helps in growth or regrowth of hair. Please shed some light on that.
This is again very interesting because market is right now flooded with products that contain onion juice for hair growth, and a lot of my patients have been asking me about it. Now, this is not a very, I don't have a direct answer to this because there are publications which support the use of onion juice, but there's no hardcore data or evidence that says that yes, go ahead, use onion juice for your hair growth. Because onion juice is supposed to contain growth factors, which do, generally give you improvement in hair growth. This is generally seen in a particular kind of hair loss condition called as alopecia areata, where onion juice has shown that there can be a hair growth. But in my experience, there's no harm in trying onion juice as long as you do not develop contact allergy to onion juice, because I've seen a lot of people getting blisters and boils on the spots they've used onions. In fact, they've rubbed onions. So if at all you're trying to use an onion juice, you can, do not rub it too vigorously. Do not keep it for a long time. And if you're developing blisters or boils, please discontinue using the onion juice because it can cause you serious troubles. So that is as much I would want to say about the onion juice, though I wouldn't recommend against it or for it. It's something that should be decided by a person themselves. As an expert, I would not recommend to use the onion juice for every kind of hair loss. That's my personal opinion.
One more question that very often comes to my mind is about laser skincare. Now, laser skincare, how safe is it, and what about people who are pregnant or who have had a baby? Is it safe for them? Also, can laser skincare routine or can laser treatment be done by men?
Wow, I'm very happy that you've asked me about laser for skincare, and I love it because lasers are one of the most commonly done procedures in my practice, and we employ about 10 to 15 different kinds of lasers. But for the purpose of your question, let me talk to you about three most commonly done lasers. One is laser hair reduction, second is laser for pigmentation, and third is laser for anti-aging. Now, laser hair reduction is done, it's very safe, it's very effective, and it's commonly done for women who have issues with unwanted facial hair, unwanted hair on the neck, unwanted body hair. So now women have opted for full body laser hair reductions, and I think I've seen a change in trend from waxing towards laser hair reduction. Now, coming to the fact is if laser hair reduction is safe, well, it's very safe provided you are doing it at a right place with the right person and they have a good machine. I'm seeing a lot of spas which have come up with these really cheap Korean machines and all that. So I wouldn't highly recommend doing a laser hair reduction at spa because at the end of the day, lasers are medical procedures and you should not be entrusting your skin with somebody who does not have the know-how of skin. So in my opinion, lasers are as safe as your doctor is and as the machine is. Okay. So I hope that answers the query about the safety aspect of the laser hair reduction. But by all means, please go ahead, do the laser hair reduction. It gives you great amount of freedom from waxing. My wife has done it, my mother has done it, so I can only vouch that if my own family members have done that, it is a thoroughly safe procedure to be done. Okay, coming to the lasers for pigmentation anti-aging, a lot of people are opting for things like that because people don't want to take invasive treatments like fillers and Botox. So people do like to take something which does not have much downtime, and and they don't want to look too different from what their face is. So a lot of people are opting for anti-aging lasers and anti-pigmentation lasers per se. They are very safe, and the devices are very sophisticated, and you do not have major downtime or complications there. Coming to the fact that if men can do the lasers, yes, roughly about 10% of my patient practice comprises of men, and a lot of them are doing lasers. The major indications for which men are doing lasers is beard shaping. They have a lot of hair on chest and back, in which a lot of pimples and boils come. So they're doing it hygiene sake in the chest, back, underarms. A lot of guys are doing lasers for their acne scars because there are a lot of scars after chickenpox and acne, so they want to get rid of those scars. So a lot of people are doing lasers for that. And a lot of elderly men are coming for anti-aging lasers because they want a little bit of firmness in their skin quality. So yes, men can do all the lasers that they want. Like I said, 10% of my practice comprises of men. And coming to the fact if lasers are safe in pregnancy, well, lasers cannot be done if somebody is pregnant, and lasers absolutely cannot be done if somebody is still breastfeeding. So, in my practice, we generally ask people these questions, and if during the course of their lasers somebody really gets pregnant, so we ask them to stop the laser session, then we begin them again once they are done with the breastfeeding with the child. So I hope that answers your queries regarding laser hair reduction.
This is a question that I ask personally from you, and it's something which I have always been intrigued by. So, all these videos on night skin care routine, which are so famous, uh, what is the right age to start following a night skin care routine, and what should be a simple, maybe 5 to 10 minutes night skin care routine, something which a mother like me can also follow after a busy, hectic day of seeing patients? What is a basic night skin care routine?
Wow, I'm so glad you've talked to me. In fact, you've asked me about a night care routine because you'd be surprised how complicated night routines I do come across in my practice. Mm, People are loading themselves with about 6 to 7 different creams at the night. Okay, so let me tell you very honestly, anybody who's above 30 can have a night care routine. The whole concept of having a night care routine is very simple. It's post 30 that you start seeing these early signs of aging in terms of pigmentation, in terms of fine lines, in terms of textural abnormalities. And you would want your skin to repair and heal itself. And that happens very beautifully in the night. Okay, so that's the whole point of having a night care routine. Now there are few ingredients which should be part of your night care routine if you are having a normal skin, which is neither too dry, neither too sensitive, neither too oily. The foundation of such night care routines is laid by retinol, which you can apply maybe twice a week. AHA or alpha hydroxy acid containing cream, that is like glycolic acid, which you can do maybe twice a week in the night, and layer it up with a serum if you feel the need to. The serum can essentially contain hyaluronic acid. It can even be a vitamin C based serum, and you can then load it up with a moisturizer. So this is how you go about a night care routine. It's very simple. Cleanse your skin, put a AHA or retinol, then put the hyaluronic acid and a moisturizer. It's as simple as that. Nothing too complicated or fussy about it. But just let me throw a caution to the wind here, because people with dry skin and sensitive skin can really react badly to retinol and glycolic acid. So I mean, it is always very nice to pick ingredients based upon your skin type and maybe ask an expert to help pick ingredients. More or less, night care routines are they're really achieved. The best night care routines are really achieved after trial and error of products, because not every product is going to suit everybody. So please do have a night care routine if you're post 30. It's a very good way for your skin to replenish itself. So this was fantastic. I loved answering to all the queries. Thanks a lot, Dr. Era, for making me a part of this wonderful initiative. If you have more questions, please do direct them to me. I would love to answer each and every query. In the meantime, to you, to your patients, and to all the people who've had queries, stay safe, stay indoors, and see you later. I would love to answer all your queries. This is Dr. Ishad Agarwal signing out. Thank you.
Thank you so much for being a part of this lovely initiative. I'd love to shoot more questions your way. If there are any more skin questions, please leave them on our IGTV video, and we'd both be happy to help you. Thank you, Dr. Ishad.